Tonight we're talking about the National Broadband Network. Michael Williams, you're a doctor, you run children's services at Mackay Base Hospital, and you do video conferencing that we've been talking about with your patients on the existing fibre network that you have there, that Queensland Health uses. Manu Bobo has been having a look at how it works. Let's have a look.
Oh, that's a great view.
This is the way many patients in Mackay see a specialist.
Unfortunately, in Mackay, although we're a good size, we don't have an ENT, ear, nose and throat specialist, in our hospital, in the public hospital.
If you look at the tablet, and then you'll be able to see your ear up there.
So this is a way of providing that service to our patients without them having to travel in the first instance.
For the Prentice family, it's the only way of finding out what's wrong with their child quickly.
You've had to fly down to Brisbane. The way we're going with financial at the moment is probably struggle, and this, I know that this will help a lot. You know, just knowing what's wrong with your kids and not having to fork out money to go down to Brisbane.
Dr. Michael Williams is the Director of Child and Adolescent Services at Mackay Base Hospital. He's been doing telemedicine consultations for 13 years.
Really, the patient, say in our district, if they were in Claremont or in Proserpine, they should have the same access, and I can deliver that to them, that same access to a paediatrician as though they were presenting here to the Mackay Base Hospital or were in our ward. And I can do that via telehealth.
Even though the specialist is seeing his sister Chanel today, 9-year-old Keelan Prentice has been through this too. If it wasn't for telemedicine, his heart problem may not have been detected as early as it was, when he was just 1 week old.
Because as soon as I had him, they sort of did it straight away. And it's just good to get the results without, worrying about going to Brisbane and just waiting to see what's wrong with him.
Detractors might say, well, you can't examine the patient, you can't lay a hand on to feel what the abdomen is like. But you're making your assessment knowing that, but you would generally try and have the GP at the other end, or in our case it would be us, and we're telling the person what we can feel on our examination.
The Prentice family won't avoid travelling the 1,100 kilometres to Brisbane altogether. 3-year-old Chanel has to have her tonsils out.
So you'll have to come to Brisbane for that.
Okay.
Now, what that means, unfortunately, is when you come here, you need to stay down here for 2 weeks after it. Okay, because there's a risk of a bleeding problem afterwards.
Michael, Queensland Health has a fibre network already, so how will the NBN make a difference?
Well, I think that it may be able to extend things further out, and particularly beyond the Queensland Health network, into the private medical centres, into the home. We could do follow-up of some patients in the home, and I think it will provide a better quality of the video conferencing in the home and at those sites. And indeed, when I'm on call, I might be able to get good quality provision through to looking at an emergency call from one of our outlying hospitals and assess the patient.
Okay, so more people would have access to that quality of picture and the quality of service.
Yes.
Yeah. Melissa and Danny, I just wondered, one of the kids is asleep here, bless her, look at her. I just wanted to ask you both, what's it like to actually have a diagnosis done that way?
It just helps out a lot. Trying to find out what's wrong with your kids straight away without having to go down to Brisbane and with finance and that.
Because a heart problem on a baby, it was effectively, and that was all done via video conferencing.
It's actually pretty scary, but when Dr. Williams found out and then he organised that interlink, it was a lot easier and nice. Not stressful.
Patricia, I know that you live in Smithton in Tasmania where the school is, and you haven't hooked up to the NBN. How would you feel about doing video conferencing like that for health? Because older people are being cited as some of the people who could be, make use of a service like this.
Yes, I believe that it would be very good for that, yes.
So what do you think of the NBN, and why haven't you hooked up?
I don't think that I could find very much use for it, that's one thing.
And I do wonder about the cost of it, because they were, broadband was in Smithton for 5 months, probably hooking up about 2,500 homes. And those men, they really worked. They worked through gales and sludgy sleet, and they worked from sun up till sundown, and it still took them nearly 5 months.
Okay, so
there was hundreds of them.
Okay, so you're worried about the cost. Malcolm Turnbull, though, I want to ask you about what Michael says, because, I mean, if the NBN can deliver more services like that to more people, and savings, because it saves money. It saves money for people having to travel, you know, when they don't have the money. It also saves money for the system. Isn't that a compelling case for extending that coverage really comprehensively across the country?
Well, I think the first point is that Michael's got that connection at his hospital. There are about 1,300 hospitals in Australia, I think, and most of them have got broadband connection, and certainly all of them should have, just like all schools should have. The question is, and Michael said, there are a lot of mights and coulds. It could do this, it might do that. Isn't that a good reason for having a very hard-headed, careful look at this? We're spending a lot of money on infrastructure. Stephen says you need 100 megabits per second. Again, here are these Americans that Stephen doesn't think know anything. They say a single video consultation session can require a symmetric 2 megabits per second connection with a good quality of service.
But is the American system a good model for us?
Well, given that they, well, I just say this, Jenny.
I mean, but it's
okay,
good
no,
point.
Jenny, I just say this: the Americans developed the internet. All of the major technology companies
Why is Obama asking for a fibre to the home network? Why is Obama asking for that?
The fact is, as I said, we've got a situation where we are undertaking 100 times more per capita government investment in this than the United States. There is no country in the world that is doing what Stephen is doing or spending the money he's doing, and nobody is doing it with so little analysis or consideration.
Stephen, response to that. No country in the world doing this.
Responses. Larry Smarr, an American, one of the founders and fathers of the internet. He comes to Australia regularly to say that what Australia is doing is the best in the world. He says if people say they can't imagine what you do with 100 megs, that's a failure of their imagination, not 100 megs.
Well, what do you have to fear from the Productivity Commission,
Tony, what do you think listening to this going on? I mean, I'm just interested in what you think about the models that are being cited and the fact that we are spending all this money. Are you worried about that?
There's a political argument going on here, and it's about trying to delay the system. Let's look at the issues that we're trying to deal with in this country. We have a big land, we have people scattered across it, we have health issues, we have doctor issues, we have educational issues, we have a population debate going on in our major centres, and we have business issues. The one thing that can get that right in terms of all of those issues, delivering services that are going to be scarce, aged care, keeping people in the home. We're going to have a bubble of aged care people coming through the system. What could this sort of technology do in real time to assist those people? Now, Malcolm says it can happen now, but we don't know the forms of technology that will be available in 5 years' time. 3 years ago, we begged for towers in Tamworth and couldn't get any more towers. Now, Telstra was in the other day saying they're going to build another 5. The demand for some of these products and the internet products and some of the internal home products is almost exponential.
Okay, Michael, what did you want to say?
Look, we're doing some good telehealth now, and I think telehealth is great for delivering that equity of access. I think the big need now, before we start thinking too much beyond about more technology, is to get the doctors supported in the right way, with more support, with incentives to go to telehealth and directives to deliver those telehealth services with the current technology. We can do a lot more with what we've got now.
That's a whole other debate about the doctors. Kevin, what did you want to say?
There's an equity issue here. At the moment, you have 40% of the households in the lowest quintile, which is almost 800,000 to 1 million households, who can't afford dial-up. They can't afford $10 a month for internet access. Now, unless Stephen can tell us right now the pricing on the NBN, and it's going to come in at below $10, those households are out. They're out of all his wonderful new world of services.
Okay, what can you tell us about the pricing though, Stephen Conroy? Because a lot of people want to know that, and they want to know if you can guarantee